Hello everyone, I'm Ben Mattinson. I'm the Managing Director at Wincourt Nursing Home, a nominated individual in Timperley, which is just a posh title really for it's a family-run business that I help run. Our home's been part of the community since back in 1997, and over the years I've seen just how much experience and knowledge that does exist within social care. So today I'm just going to share a bit about my journey becoming a research champion, how it began, and how small independent providers like us can hopefully be part of real research. Why I wanted to get involved. I was brought up in social care. I literally grew up at the home, around the residents, the staff. And when I went off to do physiotherapy at Huddersfield University, I learned how central sort of evidence-based practice is to improving outcomes. When I came back into social care after having a family, I realised that that same evidence-driven mindset was often sort of missing. It was often best practice or this is the way we do things. And I just sort of thought, well, I'd like to sort of bridge the gap between what I'd learned at university to take what I'd learned and apply it into a care home environment. Becoming a research champion has given me this opportunity to connect sort of everyday frontline experiences with the academic research and to help show that independent homes can lead and innovate too, really. So my research champion, what I'm doing at the moment. So what I wanted to look at is workforce sustainability and welfare, as well as sort of innovations and technologies, which worked out pretty well for me because there was a GMC funded pilot that was going on as well at the same time, which I applied for and won, which sort of tied in really well for me. In social care, there's a lot of issues around workforce, recruitment, keeping people in jobs. But one thing that I've noticed at Wincourt, we do have a massive turnover of staff, but we do have an ageing population, and we want to keep staff in work as long as possible, so they don't have to leave and retrain. But there's a load of evidence sort of out there about the physical demands. We do a lot of complex nursing, so it's a lot of rolling. It's a long day for them, and we don't really have other roles that they can necessarily progress in, like fall back into, if you like. We've already maximised what we would call those roles. So I've looked at these technologies, which are like bed. They roll residents for you, so you don't have to do any physical input. And there was lots of research. Well, there's no research really out there around this in social care or anything sort of in this country. So yeah, we're going to look at how it's going to affect the well-being, manual handling times, as well as resident comfort, and see if we can just sort of implement it into our normal care routines. I've also managed to spend some time working with other research champions and researchers, being approached through the ARC and through the university for innovations in technology and social care, training implications, best practice, which has been really cool. And people just reach out and then you can sort of do the practical bits of how it would look like in a home, which has been really good. Yeah, next slide. Progress so far, success and challenge. I'm still quite early on in terms of the journey. I've only just got the beds, but we did win the grant for the beds, so we got £11,000, which was amazing. We've managed to add to that as well a little bit at the home, so we've now got 5 beds when the initial project was going to be 3. We've got 35 residents, so it's a decent portion for us. Yeah, so that's the biggest sort of success so far in terms of, as well as the networking and things. In terms of the challenges, I think the first bit was just getting into it, and it was just like, wow, this is a change of pace for us. I know, like with Chantel, we would just be like, right, we're researchers now. What does that mean? And like working in social care, it's like it's so task-based. It's like bang, 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 right, well, what do you want from me, Caroline? Like, tell me what you want. And it's not like that. And you start feeling more comfortable in the role, and these guys have been great, and all the support's been amazing as well. So I'm starting to feel a bit more comfortable in saying I'm having to think about things, and yeah, getting there anyway. And looking ahead, I just want to complete the evaluation and share the findings, maybe with other homes providers, ICBs, because obviously it's a lot of money, these things, but they can save costs and they can improve outcomes for residents and for the staff, basically. So yeah, the next step will be just seeing how I'm going to get that out there if the results are what we're hoping for. And then long term, it's just sort of embedding that research culture into work within everyday care, where we're questioning, testing, and trying to improve our day-to-day practices. Thank you very much.